All right, good morning. This is Wendy Mangum, Associate Degree Nursing Instructor from Meridian Community College. I'm going to be demonstrating a Foley catheter insertion using a modified technique, using a water bottle as the urinary meatus. This skill can be found in your student handbook, and we're going to go through the check sheet. So the first thing I'm going to do is check the healthcare provider's orders and make sure that I have an order for a Foley catheter. I'm going to be looking at my patient's name. Then I'm going to come in, I'm going to wash my hands, I'm going to identify my patient, by their name and date of birth, verifying that with their armband after they have told me so. I'm going to ask the client if they have any allergies. I'm specifically concerned about latex allergies or betadine or chlorhexapret, whatever may be in your Foley catheter kit. And the chart would also be able to tell if they've had allergies to those things as well. All right, I'm going to exit the room. I'm going to go and gather my supplies. Your supplies are going to be your Foley catheter kit, and if you so choose, you can get an extra pair of sterile gloves, or you can utilize the sterile gloves that are in your kit, and that is what I'm going to do. This bed right here does not raise up to waist level, and a lot of you at home may not have services that will raise up, and that's perfectly okay so long as you verbalize it. So I'm verbalizing that coming back in, I would wash my hands again, and I would raise the bed to above waist height to maintain sterility, okay? And I'm also going to find a table to use to set my sterile field up. So I'm going to bring a table in here. My table is going to be above my waist height, and then my bed would be this way as well. I need to be on the other side, I think. I can do it from this side. All right, so I'm going to raise the bed up. I've already done all my proper identification. I've exited the room, so I'm going to wash my hands again. And I would actually need to apply some clean gloves and check my patient's perineal area to see if they needed peri-care prior to the Foley catheter procedure. So they do not need perineal care, so now I'm going to remove my gloves and I'm going to wash my hands again. Okay, now I'm ready to begin the sterile procedure. You do not have to worry about draping for the purposes of this competency. Just know that in the hospital setting, you will drape to provide privacy. When clients are in single rooms, you may just shut the door or you pull a curtain if necessary. So I'm going to start by opening my kit. I'm actually going to move my table on this side. I do not use the plastic bag, but certainly if you would like to, you can. I'm going to show you a different way if you would like. So I'm going to put my Foley kit on the bed here. Remember, you're going to open away from you first. You're going to open your sides. I'm going to get my gloves out of here. Now this may vary a little bit from how you were shown in class, and that's perfectly okay. I choose to put my gloves on. So I'm going to open, same principle, away from you. I'm going to open my sides. And I'm going to straighten this out. And I'm going to look and make sure and see if I can find the thumb. I'm going to pick up my gloves. I'm going to hold above. gonna steady my hand here. Now I'm gonna fix my glove. Now I'm sterile. Okay. This is your absorbent pad, and it should be, I can touch anywhere on this because I haven't laid it down yet. So as of right now, this thing is totally sterile. It will become contaminated as soon as it touches the bed sheet. So I'm gonna look and make sure that I have my shiny side. Okay. And I'm just gonna lay it down like so and let it fall. This is your fenestrated. It has a hole in it. Okay, it doesn't really have a shiny side, it doesn't matter, but I'm gonna actually utilize this because it'll be easy with a bottle, and I'm gonna lay it down as well. And I'm just gonna drop it just like that. In these kits, you have 2 packs of swabs. You only need to utilize 1. So I'm going to take 1 pack and I'm going to set it to the side, drop it. These are just wet with water, so they don't have any betadine in them. I'm going to go ahead and take my swabs out and lay them on my kit. I'm going to separate this out. I am going to open up my lubricant. I'm not dropping my hands below my waist. At this point, I'm still completely sterile. I can touch anything in the kit. I'm going to be very careful to not let the tubing flop. I'm going to lubricate. What it says in the book, 1 to 2 inches, I believe, for a female. I'm going to set it in the lubricant. This is my sterile water that I will connect. This kit said it had been pre-tested, so I do not have to test. Now I'm about ready to contaminate my non-dominant hand to spread the labia, or if this was a male, I would be, holding the penis at a 90-degree angle, getting ready to clean. So I'm going to take my non-dominant hand, and I'm going to, okay, so if that happens, if you have it elevated on a pillow, just say that, you would, have to contaminate because you're going to have to get to your bottle. So I'm going to reach, get my bottle right there. I'm going to hold. Okay, now I'm getting ready to clean. So I've spread the labia. My left hand now can no longer touch anything that is sterile. So when you clean away from you first. So you would clean. Okay, then you would take this. You would not want it to go over your sterile field. Clean. And then you would clean down the middle. Now you're ready for insertion. Okay. So with the female, you're going to go in 2 to 3 inches. You're going to see urine. Then you're going to go in another 1 to 2. Then you're going to take your non-dominant hand and you're going to hold below. You're going to inflate your balloon. You're going to detach and you are going to give it a little tug to make sure that it is in the meatus and not coming out, okay? As the urine was coming out, you were observing the color, clarity, consistency. You want to make sure that you tape the catheter to the inner thigh and you hang the bag on the immovable part of the bed. And if there is more than 700 or whatever the policy says, you would clamp it and then come back. We always have to worry about bladder spasms or them losing too much volume too quickly, okay? So that is the insertion of the Foley catheter. If you want to remove a Foley catheter, of course, you know, all of this would already be cleaned up and you would provide perineal care if they need it. To remove a Foley catheter, you check an order. It's a clean procedure. It's non-sterile. You need a 10 ml syringe so that you can deflate the bulb. I knew how much to put in the bulb because the Foley catheter kit told me it's a 5 cc balloon, but in order to fill the bulb appropriately, you put in all 10 milliliters. Okay, and you know, if you need clarification on that, I can send you some policies, but you will utilize all 10 mLs of the sterile water. Okay, so I put that, I've got my syringe, I've got an order to take it out. You wash your hands, you come in, you identify, all those same principles apply, but you would want to hook this up to where you had inflated the balloon. You see the fluid comes out very easily. You make sure that all of it is out. Tell the, you would touch the patient's perineal area, tell them to take a deep breath, and then you just remove the catheter, okay? All of this would go in a red bag. You would, clean your patient up, and you would encourage them to let you know the first time they void after the Foley catheter has been removed, okay? Let me show you real quick how to properly take off your gloves. To take off contaminated gloves, you want to pinch from the middle. Pull them off, then you ball them up, and then you go underneath the cuff. And if that happens, sometimes it does, you just try and go underneath the cuff still, and then you throw your gloves away, and you